We are here with Debbie and Jennifer Stevenson. They are parents to CDH survivor Eli. You ladies, would you like to introduce yourselves and tell us a little bit about life before CDH?
Sure. I'm Debbie Stevenson.
I'm Jennifer Stevenson.
Life before CDH was very different. I almost don't remember some days what it was like because we've had such a huge focus on CDH the past 3 years. But we had, at the time, a 2-year-old son, Zachary, and we traveled a lot. We kind of lived in this blissful, naive world, maybe. He went everywhere with us, never thought about germs, never thought about anything being wrong with him. He was healthy. We were a very active family, always on the go, living out in Colorado with family all over the country. So we just had a very normal life, normal work days, a lot of activity. You want to add?
Tell me a little bit about the first day you heard the terms congenital diaphragmatic hernia.
We went to the doctor for our regular 18-week ultrasound, and we had been through a lot previously, and so the ultrasound tech knew us and was very sensitive to us, and she tried not to scare us, but she said everything looks great, except there is one thing that I think his stomach is maybe on the wrong side of his body. And she said, but don't worry, we're just going to send you to a high risk doctor who can do some better imaging and just verify it. And even if it's nothing to be scared of. Sometimes kids have organs flipped. There's all different reasons for it. So don't panic yet. And so the next day we went into that high risk MFM, and they did some testing and ultrasounds, and they kept looking, and he said, what did they think was wrong? And we said the stomach was on the wrong side. And he said, no, the stomach's on the right side. I think he has a heart condition. And so he kept kind of messing around with it. And he finally came back and said, no, he has a congenital diaphragmatic hernia. We didn't know what that was, but we thought that hernia sounded a lot more benign and better than a heart condition or his organs being reversed. And so I said, thank God it's, a hernia. And he said, I'm sorry, it's not that kind of hernia. And at that point, he started having the conversation, encouraging us to maybe terminate the pregnancy.
That's hard. That's hard to hear those words.
Yep.
It is. So tell me a little bit how your pregnancy went from that point on.
I think right after that, we left to go on vacation to see our family for the holidays. And we were frantically trying to get in with somebody to kind of walk through what our plan was. I mean, the pregnancy was very uneventful, I think. I mean, it was just, lots of doctor visits, lots of meeting with our team, things like that.
Did you guys tell your family up front that baby was sick?
Not initially, no.
We didn't want to worry them yet because we didn't really know what we were dealing with. We found out on December 13th that he had CDH, and we took off on the 15th to go on vacation. And so we tried to act like everything was fine. And
Christmas
just kind of, we didn't want, to upset everybody over Christmas and New Year's. So we just kind of pushed through it and spent all the time we weren't with them, reaching out to medical centers across the country, trying to figure out who could treat this, who had the best survival rates, because we were willing to pick up and relocate at that point wherever we needed to for whatever period of time. And so that doctor actually called back to remind us of the guidelines in the state of Colorado for termination. And I fired him on the phone and told him we didn't need him, that if there was a chance that we were going to go find somebody that would give us a better chance. And that, he wasn't the right fit. So we spent that whole vacation trying to figure out and making phone calls and talking to medical centers of where we could consult and who might be able to help.
How did you decide to go with the hospital you went with?
Ironically, I had a doctor, I mean, I'm from Atlanta, so I had a doctor that I ended up seeing because I was having some stuff when we were on the road for vacation. And he had a relative that worked at Boston Children's and was one of in their MFM office. And so he reached out to her, and she called us while we were driving between Atlanta and Alabama from my family to hers, and said, do you have a few minutes to talk? And we kind of went through it, and she said CDH is very serious, and kind of reinforced what we already had learned and researched. She said there's a lot of great programs, and if you guys live in Colorado, you should start in Denver. They have a phenomenal program. At least go consult with them. And if you're not happy there, call me back and I'll be happy to get you in, at Boston Children's, and we'll bring you over. So she actually told us to start in Denver. And so we made an appointment on vacation to go consult in Denver. And when we got back, then the next day after vacation, we went and met with the team up there.
That's
and
great.
They were awesome.
That's awesome. That's great.
They were fantastic.
It was an amazing experience with them.
Yeah. I mean, we spent 5 or 6 hours up there
with a room full of people, video monitors, boardroom style. So
all the stuff, Jen, her test that she had gone through that day and MRIs, and then they had everybody in there and pulled everything up on the screens and said, here's what's wrong here, and here's how we're going to treat that, and here's, and they took us through the whole thing. And said, your family now, and gave us a lot of hope. So we never looked back. We just said that's where we need to be.
Right. That was perfect. That worked. Everything worked out for a reason.
Yeah.
Yep. And they were fantastic.
So tell me what happened at birth. Did you guys have an induction, a scheduled induction, or did you let birth happen naturally?
No, it was scheduled, and there were about 10 people in the room with me, and about 15 people in another room waiting for Eli. That once he delivered, they walked him over to an adjoining space where they resuscitated him and intubated him and all of. You can tell that story because I was a little preoccupied at that point.
Yeah, we did a scheduled C-section at 38 weeks on the dot, and Zachary had been a C-section as well, so we had to do a C with Eli, and they actually preferred that, I think, in Denver. So we did the C-section, and then as soon as they pulled him out, he did cry, which we didn't expect. And so he let out a cry. They whisked him off, and I ran with him to a adjoining hospital room that had the glass blocks, kind of half wall, and so I could still look back and check on Jen and see her. But I was in stabilization with him, and the surgeon came in and spent time kind of helping to support me, and went up. I was afraid to go take pictures of him because there was a whole team standing around. And so he walked up and said, give me your phone, and started taking pictures, and then took it back and showed Jen. We had people from the MFM side and the sonographers that were in there with us just to support us, kind of watching. So we were in stabilization for over 2 hours. They told us it would probably be pretty quick, and then we would go to the NICU and they'd finish up with Jen. They had taken her out and back to recovery well before we finally got out of stabilization. So I think his course right after birth was more difficult than what they had planned for. But he did well. I mean, they got him stable and moved us down to a NICU room, which was great because it was on the same floor as the delivery inside of Children's Colorado. So literally, once she was able to get to be a little bit mobile, they put her in a wheelchair and brought her down to see him right away, which was really nice.
Yes. That would have been hard to have to wait to see him.
Yeah. So
how did the first 48 hours go? Did he remain stable?
No. He had 2 pneumothorax, so he had 2 emergency chest tubes. they thought he was going on ECMO the first night. So they brought in, I guess you have to be on a special mattress for ECMO, which I wasn't aware of. So they brought in an ECMO mattress and started lining things up, expecting that he was going to have to go on. He had really bad pulmonary hypertension at that point. They couldn't get his blood pressure stable. He was running low blood pressure. They couldn't get several of his electrolytes balanced. So he had a really rough go the first 24 and really almost heading up to his surgery. The first 72 probably were really touchy for him. And then he had surgery on day 4. He did pretty well after that. We had a couple of setbacks through this day, but for the most part, he kind of turned the corner after surgery, I think.
They actually did his surgery in his NICU room. They made it a sterile environment, and everyone came to him, so they didn't have to move him. So
yeah, and our nurse that day was phenomenal. We wanted him to be baptized before surgery, but we were so scattered that we just didn't get anything done. And so she went and got the chaplain, who ended up being phenomenal. And she came up and baptized him bedside before surgery while all the doctors were coming in trying to get everything set up. And our nurse was holding him literally outside the door, kind of holding him at bay, telling him to hold on a minute.
Oh, that was special for you guys.
So yeah, so we got to get him baptized before surgery on day 4. Yeah.
That's neat. That's special. On his repair, did he have to have a patch?
They did a muscle flap. They used his muscle. And the defect was bigger than they thought it was going to be, so they weren't sure. When he got in there, I think it was a little bit bigger. They also didn't realize at the time, I guess between the time he was born, maybe because the scans didn't show it, but his surgeon said the top lobe of his liver had started moving up. It was a little bit bigger, but they were able to do it with a patch or with a muscle flap instead of a Gore-Tex patch.
That's good. So how did the journey go from there, from surgery on? How did his hospital stay go?
You know, it was just growing at that point. I mean, it was slow and steady, you know. We were in there for quite a while. Like 2 months almost, which is not as long as, you know, a lot of people, but when you're living every day in a NICU, it's definitely a thing. But yeah, we got to come home on oxygen, a little bit of medication, and kind of just let him heal and grow for the most part.
Yeah, he did. Most of his hospital stay after surgery was fairly uneventful. We had a couple moments where he needed blood transfusions. We had a couple other moments where they thought he had some infection. He started showing signs that he was sick, so they were aggressive in treating that. So we had a few things that popped up, but for the most part, he did pretty well.
Eating difficulties? Did he have any eating difficulties?
He had really bad reflux, and so he was really slow to start eating, but once he did, and once he finally got the hang of it, he's done well. So we never had to have a G-tube. He had an NG up until he was probably 6.5, 7 weeks. So they would do a little bit by mouth, and the rest he would have as an NG. But once he got to where he could take enough, he never really looked back. He loved eating time. He still does.
Still does.
Which is good.
That is good.
And he sat at my dad's house last night and ate like 2 medallions of a pork tenderloin, which, you know, Zachary was eating mac and cheese and Eli was digging into what we were having. So
that's great.
He's always had, he's had some issues growing. So even now he's
smaller.
He's small. He's, you know, in a 4T shirt and he's in 2T pants, and we have to use belts to hold up the 2T pants.
His frame. Great.
So
To see it.
he's smaller, and he's had a lot of complications since discharge with illness and hospital stays. But
Yeah,
Just what
we've
type of
had-
illnesses? Just things respiratory that affect his lungs?
yeah, he apparently can't handle rhino, so common cold is really rough on him. So we've had 3 ICU stays for rhinovirus. We've had an ICU stay for RSV.
RSV was 10 days in the ICU.
On vacation in
On
Texas.
vacation.
Yeah,
Yeah.
we were in Texas.
Zachary and I were running to Target to try to buy socks and
Oh.
sweatpants, clothes that we could live in for once we had packed light.
Mhm.
So he's had some setbacks that way, but for the most part, you know, he's done well. We got him off oxygen when he was about a year old, and he goes back on oxygen on a regular basis when he's sick. He spent most of 2019 on oxygen full time. COVID's actually been good for him because he hasn't been exposed to people. He's been, you know, pretty much inside. So we've been able to get him off, I think around May or June of 20, off oxygen again, and hasn't been back
on it since then. So
Well, that's great.
yeah.
So how is Eli? Does he know he was born with CDH? Do you guys talk about it with him? Is he aware of his scars?
Aware, I think, to some extent, but he's still, you know, he's 3, so I don't think he fully gets it.
Mm-hmm.
He's done a lot through the hospital as well. So he was an ambassador, and we've done a lot of things for CDH. He understands, I think, that there's something. He understands that his lungs are small. He understands that he has a hard time breathing sometimes, or if he gets sick, that he takes medications that his brother doesn't take, that he can't keep up with the other kids running, so he'll have to take breaks. But he doesn't fully understand what's happened yet. Probably in the next year or so, the way he's grasping new concepts now, I think he'll understand.
I've been fortunate enough to meet you guys several times in person. 2017 at the Utah conference, and Eli was just a little guy. And then in 2019 there in Nashville. So it's been wonderful getting to know you. Debbie, you're one of our Colorado ambassadors for families, and we appreciate you volunteering and giving back and helping families. If there's any advice, what's that?
I said it's a hard road. If there's any, you know, I don't ever want people to have to go down that or, you know, hear CDH, but if they do, we're always more than willing to talk to them or help in any way we can for people that are in Colorado, because it's a hard road, and we've met some great people that we've kind of walked through that journey with them over the last few years.
And we appreciate your help and your connection with the Children's Hospital there and the doctors and nurses. You guys have got a wonderful connection, and giving back to the hospital and to CDHI, we greatly appreciate it. If there was any advice for families, or I guess I asked that, but what do you wish you had known prior? Is there something you wish you would have known before you heard the word CDH?
I think for me, it would be that there's always hope, and you just got to find the people that support that and give you that.
Right.
Because I think there's a lot of places that, you know, and there's a lot of great programs across the country and a lot of phenomenal doctors. I think that finding the one that you feel comfortable with and you really trust, that it's okay to go find that person, but that there's always hope, you know, and to hold on to that, because there's some pretty harrowing times when you go through that. And so for me, hope, and then, you know, on some level, faith that it was just going to be okay, and that this was where we were supposed to be, and that it was going to work out. Those were probably the two kind of big takeaways I had. That, and that it's never in our time, right? I mean, it was always his time. Every time we thought we were turning a corner, he would have a setback and we would get frustrated. And you know, sad and upset about it. And then we'd realize this is his fight and his time.
Right.
We always fix things, and we couldn't fix this. We just needed to support him and support his medical team and stand back and let somebody else manage it and fix it, you know, that they needed to be the ones, and we just needed to support that. And that was kind of a hard lesson, because I'm a fixer, and I couldn't, you know, I had to learn a lot of patience and humility through that process.
A lot of patience.
Yep. What about you?
I agree.
So I totally look forward to watching Eli grow up and what he does here in the future. He's a neat child, and so is Zachary. And I appreciate you guys being a part of CDHI and giving back and taking the time this morning to share Eli's story.
Absolutely.
Thank you for
Thank you for
allowing
including
us.
us.
Yes.